Good afternoon, everyone. Welcome. We will give it one more minute for everyone to join. All right, we'll get started here. Well, welcome again, everyone, and thank you for being here to our industry showcase on November 4th. My name is Ashley Caesar. I am the Programs and Events Specialist here at Digital Health Canada. So today's industry showcase is our last showcase with AWS, presenting Cybersecurity Awareness Month, and we are representing Accenture. Improve your security posture for moving to the cloud. And presenting today is Terodis Topaloglu. He is the Chief Information Officer at Joseph Brant Hospital. We have Jimmy Yang. He is the Managing Director, Canada Strategy and Consulting Health Leader at Accenture. We have Larry Sylvester. He is a healthcare leader with AWS Canada. And we also have Salwa Rafi, is the healthcare industry expert and global managing director at Accenture. It'll be a little bit different today. It will be a pre-recorded session. So if you have any questions, any comments, please feel free to post them in the chat. I will be forwarding the questions to the panelists and with your email address, and they will respond to you via email. I'll also put up the webinar email in the chat box. Feel free to email me your questions and I will make sure that they receive the questions. All right, so let's get started here. Just one moment. And here we go.
Hello, my name is Jimmy Yang, and we're really pleased to be holding this exciting session as part of Digital Health Canada's Industry Showcase. And we're here in Cybersecurity Awareness Month, and I'm really happy to be this session's moderator. We've got a great panel assembled today, and really look forward to having an engaging discussion on the topic of cybersecurity, journey to cloud, and really start to surface some real stories and experiences from the healthcare industry. As we all know, in health, the journey to cloud is an important enabler to healthcare providers and health systems. The foundation to this journey is an approach to thinking about security and privacy and how that enables this move to cloud. And certainly, while there are challenges that can be addressed, we're all very aware that the arguments and business benefits are very clear and demonstrated in industry. So really excited today to share our perspectives, key success factors, and again, stories from the field, really to gain clarity for our audience here today on how to make this journey a successful one. So in this session, it's going to be a panel discussion. We hope it's Jimmy Yang. at Accenture. I'm a managing director and I lead health industry nationally. And we work very closely in Canada with our providers, our payers, private sector on transformation agendas ultimately in health, driven by innovations in digital technology modernization and big data. And so very happy to be a part of today's panel and to moderate. I'm going to pass it over to Sawa.
All right. Thanks, Jimmy. Good morning, good afternoon, everybody. Very glad to be here. My name is Sawa Rafi. I'm the Global Managing Director for Healthcare Security with Accenture. We are all here as healthcare professionals, and we think this is the most important industry. And Jimmy, thank you for the interest. We are very happy. And we are thanking our colleagues here to include us in this discussion. Larry?
Thank you very much, Sawa. So I'm Larry Sylvester. I'm the healthcare leader for Canada at Amazon Web Services. Elated to be able to participate in this panel with my esteemed colleagues on this very important topic, and looking forward to diving into some of the debates and discussions around them. So with that, over to yourself, Theodoros.
Thank you, Larry, and good day, everyone. Jimmy, thank you for the invitation to be part of this event on such an important topic. And I really look forward to hear and learn from Salva and Larry and from their experience on cloud security and the value proposition for cloud technology. For my part, I hope to bring in the voice of the healthcare provider organization, and also to share some of my own thoughts on the potential of cloud technology to move the innovation needle forward in our industry. I am the CIO at Brant Hospital in the past 2 years, for the last 2 years, and in the past 12 years I have served the CIO capacity in a number of Ontario hospitals. I'm a computer scientist by training, and before healthcare I worked in research and development in the biotech and software industries and in academia. And back to you, Jimmy.
Yeah, thank you to you, Theodoros, to you, Sawa, Larry. This is great. Very excited and just incredible experiences. We haven't even gotten started yet. So why don't we jump into the panel discussion? And Sawa, I'll start by asking you. You wear a global hat at Accenture, and want to get a sense from you. Like, share with us what you're seeing globally in healthcare. How are they thinking about, and what are they doing in terms of building security?
Thank you very much. A great question. I'm looking at many of our clients, which are, who are in the providers and payers market and public health, as you mentioned, and every single person, every single organization is on a different path to the cloud. Hybrid cloud is here to stay. Healthcare has always been a reserved kind of industry. So we are just starting the journey. Some of our clients have gone a long way, and they are looking at multiple platforms. They're looking into using the security controls that come embedded within the cloud platform. And some, frankly, are still thinking about it, are still trying to design a strategy, a security strategy, or a cloud strategy that would pave the way for them to move to the cloud. I always tell our colleagues and clients that moving to the cloud is inevitable. It is really the enabler for all of the innovation that happens in the medical technology, in healthcare, in all of that. And security should never be a back burner. It's not a cost factor here. It is an enabler. Frankly, when I talk with my clients, the main concern that is, kind of getting them to think and take their time to move to the cloud is mainly security. They often ask the questions, is my data going to be secure? How about patient privacy? Am I going to have my data back if the platform has gone down, or if there is an outage here? And so all of these concerns are really geared around security. And it has to be a comprehensive view of, it's not just a lift and shift. It's not just moving the data from point A to point B. It has to be designed carefully, security, and sometimes you have to embed the DevSecOps into your operations, into your applications. And we are here to help all the way from the strategy all the way to the security of medical devices, security of the IoT in general, how to move your applications safely, how to move your data safely and keep them within an optimized operations and optimized and secure operations. So yeah, we're looking at a very big landscape here, and everybody has a different degree of maturity. And we can help you take the organizations from a very like 1 degree of maturity all the way to the highest maturity when we see automation, we see AI embedded into the entire infrastructure, and this is all enabled by security.
Yeah, thank you for that perspective, Salwa. And you raised this question. Is my data going to be secure? So it sparks that. We're about to release Accenture a Future of Health Canada survey where we've really canvassed 2,000 Canadians on a number of topics. What's interesting is that while the trust in how personal health information is handled is lower in call it digital applications, wellness applications, so 53% of Canadians trust those forms to protect their information. It's very high, actually. In terms of trust around PHI with providers and hospitals, 90%, and with government, payers, health authorities, 83%, so very high. I guess what must healthcare leaders do to ensure the security of health information with patients and families? How are they thinking about that?
They are doing lots of things, many initiatives to ensure that there is a trust factor when we move the data and the apps from on-prem to the cloud platform. Many of the cloud platforms, AWS as an example, comes with very sophisticated levels of controls that would enable any organization to take advantage of that and move the entire workload securely. But many of them cannot do it on their own. It's the lack of knowledge, it's the lack of talent. Frankly, as we see it, even as a security organization, there is a very big shortage in security talent, especially in healthcare. So what we see as well is a misconfiguration. This is probably the most common issue when our clients and organizations move to the cloud. The first thing we see is misconfiguration, which can compromise the visibility and can compromise the security of the data and the applications. And having data residency issues as well. I see that as an important factor, definitely for Canada, whereas the PHI and PII need to be within the country. So some of these are concerns and factors of the organizations. I think having a trusted partner, frankly, helps a lot. And we have many testimonials from our different organizations around the world that having a trusted global partner that can bring in the best practices and accelerate the journey with these assets really gets through the point and the ongoing operations as well.
Yeah, thank you for that, Sal. And you raised Canada as a country, a market, a good bridge, I think, to Theodoros, the hat that you wear as a leader in the provider setting here in Canada. So wanted to ask you a couple of questions. From your perspective, we're talking about cloud and security. What are some of the more important benefits for healthcare providers and leaders in moving to cloud? And from what you've seen and experienced, how does this journey drive acceleration in the health mandate, drive the health innovation agenda?
So Jimmy, I want to say that the benefits for moving to cloud are well understood by now, although that may not be the full reality. There is some experience and some experience by fire in moving to cloud, and everything that Salva said. There is the fear of misconfiguration. There is the understanding of the legal and regulatory environmental legislation, and there is this concern or lack of knowledgeable resources on our side to complete the journey. I'll say that in terms of cloud doesn't make sense from the financial perspective, doesn't make sense from an effort perspective. And this is an appealing, the cloud is an appealing alternative that we start to explore, start to get to. Software as a service is also becoming a preferred option to most of our application purchases, and our RFPs will tell you that this is a preferred choice. On-prem solutions usually have longer implementation cycles, longer deployment cycles, and longer cycles to time to value. And the pandemic has been a good example of what we can accomplish and do with a cloud that we have not done before. So we were able to close our gaps much faster because the need was there and the option was there. And this is a point that I will want to come back before again. I think one important thing, in my opinion, that the cloud gives to healthcare organizations is ability to access innovation. And by that, I mean access to advanced computational libraries, including AI, and build our AI strategy in the cloud. Things that we cannot do, we do not have access to do on-prem. Computational tools and algorithms that are accessible through the cloud are hard to be replicated. And this can be simple things such as online appointment booking systems, and can be more advanced things such as diagnostic algorithms for diagnosing heart failure using ECG data, assuming that you can get your data into where the computation takes place. And it's easier to move data to the computation than moving computation to the data. It's impractical in some cases to deploy things in order to test and test ideas, innovate, and fail even. And it's much easier to do that in cloud. So I think there is a pretty strong case for the healthcare experience. Examples, we start seeing that this work is happening. And for sure, there are barriers or obstacles that we need to cross. And I want to continue by adding also that when it comes to the delivering services to our patients, such as online appointments, access to virtual care offerings, the cloud is the channel. And this is what the pandemic has proven to us. We have seen that in the last 18 months, healthcare organizations, governments, setting up patient-facing systems in record times, and then iterating and growing for them as the need and the narrative of the pandemic response has evolved. And this is a good example of what we can do. And we usually in healthcare, we do it when we have the need. You need to then is the time to go back and make it more robust and systematic. So the first thing is done. The next thing is make it work better. And another point in the case for cloud for healthcare is that of the interoperability. The cloud has been built to cater to the modern needs of accessing building blocks and APIs that expose data and functionality in order to build applications. That option we do not have on-prem. And someone who has been a programmer 20 years ago, and since then, it is much easier to create solutions in a cloud-based environment, that is to do it on with basic ingredients, as we used to do long ago. So all in all, I think that we are on a journey, rather in the earlier phases of the journey. And obviously the issue of cloud security and the issue of security in the cloud and the issue of having the know-how and the resources to do that right are very important.
Yeah, thank you for that, Theodoros. And I mean, it's from your perspective, really helpful to understand, your deconstruction of the case for cloud around speed, around interoperability, data connectivity, and how it drives the innovation agenda. Just wanted to open it up to Larry just for some initial reactions on some of what he said, and see if there's any thoughts from you.
Yeah, I think the speed to capability, Theodoros, that you talked about with respect to how organizations were, pivoting into the pandemic and looking for solutions. I observed, and I'm interested in your thoughts about this, several jurisdictions were relaxing some of their data residency requirements, specifically to allow the healthcare organizations to go out and consume cloud services that may not have been available in country, so to speak. I've also heard some CISOs talking about the relative security of on-prem versus international cloud services, and making, some would say, contentious statements like having my data internationally on a major cloud platform is still more secure than having it locally on premise. How would you respond to those sort of statements? Is that in alignment with your thinking?
I would align to that thinking, and that would be for the reason that cloud platforms have been built with security by design, and they have the technical controls that you can secure your data and secure your applications and control the access, and provide a robust security environment. However, the issues that are concerns are not on the technical security. We need to demonstrate to those that were accountable that we have done the full due diligence on understanding the security issues and providing answers to all the risks that may derive from that, and ensure that all the data protection acts and requirements are followed. And that sometimes it's a knowledge gap game. Healthcare organizations do not always have the on-staff expertise to navigate such a complicated technical environment and such a complicated controls, external controls environment. This is where the capability of the platform is not sufficient. We need to demonstrate that the platform is configured properly, and we need to have the knowledge of the capability of the platform that sometimes goes beyond the knowledge that we have, and it's a journey for us to reach to that point. Sometimes we're getting there through partnerships and working with the experts before we become the experts.
Yeah, great question, Larry, and thanks for that, Theodoros. Just off of your last comment around partnerships and expertise, in your role, Larry, it sparks then the discussion around some of those key success factors and ingredients, I guess, for success. So if we think about that move to cloud done in a secure fashion, would love to hear from you as to the types of talent, the types of skills, your views on really what that capability network must be to really iron in success.
Mm-hmm. Yeah, and I'd love to say we're sort of in a point now where we're doing a retrospective on COVID and the experiences. We're almost there, I think. But I think the most acute observation is that the different experiences that organizations had in the COVID sort of the most acute times of the COVID experience for many of them was struggling to try and find the type of capabilities to be able to serve either vaccine management or call centers and reach out, or contact tracing, these types of things. Many of those solutions ended up being cloud-based. And the organizations that were most successful in moving the needle on deploying those rapidly and quickly had two things in common. One, they had a previous engagement in cloud and had a cloud a framework within which to deploy those types of cloud services that took security into consideration. Or they did so with the help and assistance of a partner such as Accenture, where they would, bring their expertise to the table to help envelop some of those solutions and the security controls that were required for it to be a responsible sort of deployment of services. Look, there's a huge human resources challenge in Canada specific, and everybody's talked about it. Sal has talked about it, Thodos has talked about it, you've talked about it, Jimmy. We're all competing for the same technical resources, and it's incredibly challenging right now for any of us to find those in a way that can satisfy the demands that our individual customers or our stakeholders are requiring us to see. And it's meaning that we have to reach across the aisle and partner a lot more effectively in order to bring those types of skill sets to bear so that we can all manage information more appropriately. And cloud is another facet of that overarching sort of vision that an organization has to have. It extends all the way from a desktop to on-prem to cloud to the policy sort of discussion and everything enveloped within it. And it's a fascinating sort of journey for many, because I think we've seen a lot of news stories in recent history around ransomware attacks and other types of things. It's giving more impetus to organizations to really focus on that, because the threat risk assessment, I think, is definitely approaching that upper right-hand corner where organizations want to be proactive about these things, which brings me a little bit full circle. The organizations that were most successful in uncertain times were the ones who had done the preparation to be cloud ready. I think that's a key takeaway here. The ability to respond at uncertain times means you've got to be prepared. Kind of like the luck is what happens at the intersection of opportunity and preparation. Certainly pertinent to the cloud success story in the auspices of COVID. In addition to that, one of the things that we have seen is innovation being spurred on by some of our customers who were cloud ready. And that innovation was something that was only enabled, I suppose, by, I shouldn't say only, that's probably the wrong moniker, but it was enabled primarily because it was not viewed as a bad thing, like it has been in some cases in the past, kind of labeling innovation as shadow IT, because perhaps IT couldn't respond as effectively as they could to the demands of innovative individuals within the organization. Establishing a cloud presence allowed them to have the security guardrails and controls to allow that innovation to occur in a way that A, was safe, B, was not expensive, C, could be iterated on quickly, and D, if it didn't work out, they failed fast and didn't lose a lot. So it was another fascinating story that came out of COVID, I suppose, to see how some of those innovators were able to act very rapidly and with agility in order to serve what the needs were, but also to do so in a responsible way, because the organizations that afforded that luxury to their innovators did so with the vision to create a secure environment for them to be able to work on those types of activities.
And Larry, I'll jump in just to say that I completely concur to everything that you said. I mean, look at the innovation in healthcare and how cloud computing, as an example, has opened the doors to these superior powers for analytics, for insights, for big data, for how to utilize the data lakes. That, you know, we as an industry, we generate so much of patient data, medical research, even life sciences, pharmaceuticals. Look at the great acceleration that happened in the innovation when it comes to vaccination, the COVID vaccination, and how we managed to innovate around that in such an incredible short time. This could not have happened with an on-prem kind of solutions. You know, cloud and cloud computing has been a major factor if you're looking into that. So, you know, the way we handle the electronic medical records, patient data, the applications, mobile apps, and the patient portals, the whole thing about analytics, which provides the agility, scalability, flexibility, and speed. You know, speed, which is very important, turning the patient outcomes into really knowledge and insights. So this has become almost an inevitable roadmap for the industry to adopt, to move to the cloud and do that securely. So security is really enabling and invigorating all of this medical research and innovation.
Salwa, I think that's a really good point. You brought up the industry at large, and certainly from an innovation standpoint, we see a lot of the companies who are typically involved in selling medically regulated software to hospitals or health systems are taking advantage of cloud and those capabilities more and more and more, which again goes back to how organizations want to establish the right type of environment for vendors like those to deploy their applications into your organization with the preconceived guardrails that would ensure that the how they deploy it is done so in alignment with your organization's privacy and security objectives. So you have to be in a position of readiness, because all of the vendors, not all, but the vast majority of vendors are starting to utilize cloud services integrated into their products. So even if you're only a buyer now and you're not innovating yourself as an organization, the products that you do buy are going to start to rely on these types of controls in the future.
Yeah.
So, Larry, you touched on two different paths that a healthcare organization has into their growth into a cloud. And one is what you mentioned earlier, this pre-existing relationship, this foundation that we can build up from, and having the basic infrastructure already in place when the time is right or the time is needed to move fast. The second is, and I think that is what we are seeing and experiencing, is those innovative vendors that they serve the industry, they serve the hospitals with their applications that they have already done the work for us. And through them, we are also increasing the internal confidence of the organization to adopt cloud solutions that were vetted by the professionals. They were vetted by people that they are accountable to us, and we can trust we can trust their work, and we can also see the benefit. So some of the more compelling examples are providers, service providers to us who are serving the need with a cloud platform, and that pushes in some positive way the organizations to learn, experience, and then pollinate other areas of the organization that can follow the same successes.
Agreed.
Yeah, great points. All I could listen to you guys talk for a few hours more, but we don't have a few hours. But I did hear a couple common threads, right? I mean, if we think about our audience listening to us today in this session, a couple of words that kind of emerge: preparation and readiness. And Theodoros, you talked about having the basics, the basic infrastructure in place. We would just like to open it up to all three of you on your perspectives and advice based on your experience on what are some of those more important components of preparation. Larry, I'll put you on the spot and ask you to start first.
I think we've had a tremendous benefit at AWS of getting the visibility to thousands of customers around the world and their cloud journeys across multiple industries. And I think one of the things that is most important is to ensure that the value proposition for cloud really, and the motions for the entire organization kind of have to start at the very top. In the C-suite, clear direction has to be provided to the organization about what the perspectives are that are going to drive a technology strategy. And security ends up being a really key component of those discussions. But it has to be an enterprise plan. I think it has to be overarching. It has to cover all facets of the technology discussion. Cloud is one component of it, but the real core strategic mission of the organization has to align with the IT strategy, which then dovetails into the security discussion and cloud discussions as a byproduct. Starting at the top, IT has a big role to play in the organization's success, specifically in healthcare. It needs to go right to the top.
Thanks, Larry. How about you, Sawa?
Yeah, I agree. And frankly, it has to be an executive decision to go, an executive enablement, so that stakeholders should enable all of the the boards and of course IT and operations and all of that, and the security team need to put a very articulate strategy of how to move to the cloud, how to assess readiness. We sometimes we have an oversight of if the organization is ready or not, and how we can get them ready for the cloud era. This is not an easy task, and sometimes it can get expensive. And that's why, with the lack of talent as well, we would like to ideally provide all of these assets and accelerators and build on what we learned. I don't want the organization to start from scratch of looking into how we can move to AWS from scratch, because we have done it multiple times. We have all of the right partnerships. We can easily accelerate this process, make it less painful, because it is complex. We should, it is complex, and putting the framework and the strategy and the right roadmap for any organization to do that is key for success.
Thanks, Sawa. Theodoros?
And I would agree that all starts by doing your homework and learning and receiving sound advice, provide sound advice, instill within the organization the confidence that you can do it right and you can do it safe, and demonstrate the value that this is a benefit to the organization strategy, and then it becomes the enterprise or corporate priority and an enterprise plan. And then the devil is in the details. You need to have the right people to do that. And I would say that our staff over the last 2 years is having a lot of fun learning cloud technology. It's a fascinating new world, very fast evolving, large learning opportunity for all of us. But we also have our day jobs and the day-to-day operations to deal with. And this is, again, where trusted partners and resources are important for us to do that work successfully and do it together. What matters at the end is is results, and for that you need anybody you can have to help you do it.
Yeah, no, I agree with you, Theodoros. It's let's not reinvent the wheel. We don't need to reinvent the wheel. And as you said, yeah, learning from previous success stories, because some of the projects we have many lessons learned. So let's benefit from all of that, leverage the knowledge, tremendous knowledge and insights, and sometimes room for improvement, and that would help you get, as you said, to the outcomes of a successful organization, very deep insights, which would really result in a much better and greater patient outcomes.
I think another point to that, Salwa and Doros, is that it is a wheel. It means it doesn't really have an end. The security processes have to be baked into the organization. It's not like a one and done. We did it today. Great, we're secure. It's as good as it was for today. Tomorrow's a different day, and you have to embed these types of processes and knowledge into the organization as a living part of it.
I agree with you, Larry. It's never a done job. It's ongoing, as you said, proactive, and also we have to be ready for whatever incident response. But security is the journey; it never ends. And yep, it's a race actually. Yep.
Yeah.
And
Well, listen,
as you can
please.
see, Jimmy, that we can talk for a very long time, and it's such a great subject to talk about. But we are deferring back to you.
No, this is wonderful. I think you've, all three of you couldn't have closed better, I think, on, really where we are globally in healthcare on this topic. And I think, Theodoros, you had called it kind of a fascinating new world. It is a fascinating new world for some. To Salwa and Larry's point, there are those who have traveled a few of those paths already. So there are lessons learned, there's some accelerated knowledge. And certainly that case for cloud and healthcare is abundantly clear. And finally, I think you had all alluded to this example, but when there's, in the pandemic, at least, when there's one common objective or there's clarity on what the path is, incredible what healthcare leaders, technology leaders, cloud leaders, security leaders can accomplish very quickly, actually, and innovate for citizens and patients and families. So really appreciate our panelists' time today. Really appreciate the open, honest discussion, the back and forth. I hope that our audience today gained a little bit today, and don't hesitate to reach out to any of us to continue these conversations. I'd like to just say a big thank you to Digital Health Canada for staging this industry series. And with that, we're going to say thank you to our panelists, and we're going to close this session. So thank you very much.
Thank you. Thank you, team.
Thank you.
All right, everyone. Oh, let me get back here. Well, I hope that was just as engaging for everyone, and they got some valued information out of that, as well as we want to thank AWS for the month of October for their Security Awareness Month. Okay, and again, if anyone has any questions, please feel free to send it now to the webinars at Digital Health Canada email, and then I will make sure and send it over to the panelists. All right, let's finish things off here as usual. Well, we thank you again. This is our last industry showcase of the season, but we do have some very interesting webinar Wednesdays for our members coming up. So next week, we have customization of order alerts through filters, impact on pharmacist override rate, and perceptions of alert fatigue. And for the rest of the month of November, we have enabling nationwide electronic health record and the key trends impacting Canada's home and community care market. You could find all three of these webinar Wednesdays on our websites. Again, webinar Wednesdays are for members. if you are interested. If you are not a member, please feel free to reach out as well, and I will connect you with someone to assist. All right, everyone. Thank you. Thank you all for being here, and have a great afternoon. And we'll see you all next week for our next webinar Wednesday. Thanks, everyone. Have a great afternoon.